Good afternoon, Mrs. T. Glad you could make it, and I'm here to help.
Thank you for meeting with me. I have a lot of concerns about me and BT.
What are some of those concerns? Oh, before we talk about your daughter, how are you doing?
Doing okay. It's been a long road since the C-section. The stitches seem to be healing up okay. It's just I've been exhausted, trying to catch up on some sleep and not be so overwhelmed.
I'm sure. Exhaustion's a mother's new middle name. And what are some of your concerns?
Some of the concerns I have is BT size, first of all. I'm scared that she's not growing fast enough. It seems like sometimes she's struggling with breathing and that she's also struggling to stay awake. So I'm worried that she's not eating as much and just not developing as fast as she should be.
Yeah, those are a lot of concerns. How about we break them down one at a time and then we can discuss them?
That sounds great.
One of your first concerns was her breathing. Those are complications of RDS, which is respiratory distress syndrome, and it occurs in premature and preterm infants because their lungs haven't had a chance to be fully developed in the womb, so they're kind of immature. The NEO staff that is here is doing the best they can and giving her the best treatment. One of them is a artificial surfactant, which a fully mature lung would automatically have, but since she's premature, her lungs haven't get a chance to build those up. So she's getting that. She's also getting oxygen will help her ease her breath, and they're making her bed conducive in temperature and keeping it as calm as possible.
Okay, yeah, it just seems like she has a lot of tubes coming out of her bed right now. It seems like a lot for her.
It is a lot with the nose and the arm for the breathing, but those are also to help her continue her growth.
Okay, so I heard the nurse talk about sleep apnea, and this is when she stops breathing. I thought only old people got that.
Sometimes they do, but also when a person kind of pauses in their exhaling, and their body says, "Oh, breathe." So the body has to kind of remind them to breathe. So what happens is an accumulation of CO2 in the blood, which usually is inhaled and exhaled on a mature lung, but being that she's immature and her lungs aren't fully developed, that's one of the reasons why she has that condition. But in time, as her lungs mature, it will decrease.
Oh, that's a relief. Another thing that worries me is her low heart rate. Is this part of the reason why she can't catch her breath sometimes?
That's called bradycardia, and that is when the resting heart rate is less than 60 beats per minute, which is great for an athlete, but for a baby, they need to the average is about 80 to 100 beats a minute. So again, it contributes to her being fatigued, so that's why she's tired more often, and it's harder for her to stay awake and that kind of thing. Thankfully, she's on a ventilator, so she's getting, again, pure oxygen, and it would help her ease her breath.
Okay. So the doctors had mentioned something about PDA and that she might need surgery. Can you tell me more about this? I really don't want her to have surgery.
Yeah, PDA is an abnormal blood flow between the heart and the lungs. And as a premature infant, the valve didn't completely get closed, the vessel didn't get closed. So some of the blood goes into the lungs, which makes it harder for her to breathe, and it makes the heart work harder. So usually, by the time they get older and mature, it usually takes care of itself. But surgery is one option, and you can discuss it more with the doctor.
Okay. Well, I'm glad that she could hopefully grow out of it. I really do not want her to have surgery.
Yes. As for the other concerns, you did mention your breast milk and pumping milk.
Yeah, I was wondering if I'm going to be producing enough milk to meet her needs.
Yeah, that's a concern of all new mothers. They're always wondering, do I have enough? Is it the right amount? Basically, breast milk is the best medicine for your infant. And as you continually pump your milk, the nutrients will change and adjust to her needs as well.
Okay. So I pumped her yesterday and gave it to the nurse, and it seems like such a little amount. And then the nurse had mentioned something about using fortified donor milk. Can you explain about using somebody else's milk? That seems counterintuitive.
Yeah, it does, especially you're wondering how clean it is, or do they process
Yeah.
it? Yeah, they do. They're very antiseptic about that, and they do keep it pure. But fortified means that they just add extra protein, which is what BT needs to grow. Also, as you continue to pump your milk, then it also gives her more of a chance, and it also will continue. As you pump more, it will keep coming throughout the year, so you'll have a good flow.
Okay, well then what about formula? Isn't that just as good? I mean, science made it, so.
Well, there's a saying that breast milk is the best medicine, and that is the only nutrient that they give preterm infants. There are many health benefits to breast milk, such that are more conducive than formula. One, it's from you, and so it's better for her in terms of growth. It's in terms of easily digestible, and it decreases the amount of infections and things like that.
Okay.
Sorry, I'm on a blank here.
But I'm worried about her gaining enough weight and gaining enough fat. Like, I want her to be chubby. What can I do to help her with that?
So just to give you an idea for the recommended infant growth, American Academy of Pediatrics recommended a caloric range of 110 to 130 calories per kilogram. They measure in kilograms, which is what BT needs not only for growth but to gain weight as well. And since she is a very low birth weight infant, her present protein intake is about 3 grams. And I've calculated an increase in her protein to 3.5 if you're concerned about her gaining weight. And this with the fortified donor's milk would also help her increase her nutrients and also her growth.
Okay, that sounds good. Are there any additional supplements that I could give her to help her besides the fortified milk?
Your milk and the fortified milk are the best for her at this time. Yeah, she needs to build up her fat reserves as well. 50% of her total caloric intake comes from fat. But being that she's premature, her other organs hadn't grown as fast or to the degree that a normal term baby would. So her pancreas doesn't produce the bile. So what they do is that they give her an MCT oil mixed in with the fortified milk, which is easier to digest for preterm babies. And then she'll be able to get the nutrients from the fat as well.
Okay, so sounds great, but how come she's still so small?
She is small. The way they calculate or they categorize preterms goes by how much they weigh. For an infant who weighs less than 2,500 grams, or about 5.5 pounds, is called low birth weight. And one who weighs less than 1,500 grams, which is about 3.5 pounds, they're called very low birth weight, which is where BT was when she was born.
Okay.
I've got her growth chart right here, so we can look at it.
Oh, that'd be great. I was wondering about that.
Okay. Looks here that when she was born, she was 1340 grams at birth, and her length was 39 centimeters, and her head circumference was 26, as you can see right there. That's why we charted it and we measured it. Babies are measured in terms of percentile. On this chart, her weight is 1.34 kilograms, which is about 3 pounds actually, and it puts her at the 30th percentile when she was born. Now she's measured this morning at 19 days, and her weight went up to 1490, which is about 3.3 pounds.
Okay.
And it's increased to about the 80th percentile, she is growing.
Oh, that's great.
Yeah. As for her length and her height, her length went from 39 to 40 centimeters, and her head circumference went from 26 to 27.5 centimeters.
Okay, so she's growing some, right?
Well, some. But even though her head size has increased 1.5 centimeters, it's still staying within the 30% percentile, which does caution as to potential developmental and growth delays.
So she's going to have problems with growth and development for the rest of her life then?
This is just for you to be aware, and it's a one-time reading. It doesn't say that we can project that far into the future. It just says this is kind of the area that she's going toward. As we say, you're doing an awesome job with your breast milk and the donor milk, and she will continue to grow.
Okay. So I'm worried that she's not eating as much and growing as much because she's always falling asleep so quickly.
Yeah, her falling asleep is a result of the amount of energy she needs to grow, and as we discussed, the sleep apnea. As her lungs mature, her breathing will become more consistent, and she'll be able to improve and stay awake a little bit longer. She's also on a medicine, caffeine citrate, which helps with the treatment of her apnea by decreasing the CO2, as we discussed, in her blood, and it helps her to breathe a little more consistently. Along with, she has a multivitamin with iron, so that's also helping in her growth.
Okay, I'm glad that she'll grow out of some of these problems.
Okay. We also have her lab results. You can look at those.
That'd be great.
Overall, the results look pretty good. There are a few numbers that we have to keep an eye on, though. Her potassium, her calcium, and her phosphorus above the recommended range. As you can see here, the high calcium and phosphorus are caused because of the bone mineralization that usually occurs between 36 and 38 weeks of gestational age. And as BT is adjusted to about 31 weeks gestational age, there are levels that would be elevated because of her prematurity. Plus being on this medicine, this caffeine citrate, it also alters the lab results. And at this point, the benefits of being on this medicine outweigh her incongruency on the mineral range.
Okay, well that's good that she's on the right track with something.
Mm-hmm, she is, she's on the right track.
So this has been a lot of information. I feel like I'm going to have questions later on.
Oh, I'm sure that you will, no problem. So let's take you know at once. So here's my card. If you have any other questions or concerns, please let me know.
Excellent, thank you. Is there anything else that I should be doing?
You did mention about looking into a support group for new moms. There's one in the hospital, and there's others that are close to your home. If you want, I could look into that for you.
That would be great.
Yeah. And also, take care of yourself. You know, you need to take a break sometimes, take a rest, you know, get proper sleep, as your mother would say, you know.
Yeah. Well, I appreciate your time and all the information that you had. Thank you very much.
Okay, thank you. Anytime. Okay.